Cervical cancer is a cancer of the cervix, and the cervix is this little donut-shaped circular region at the very bottom of the uterus. It's actually the entry into the uterus. And so the cervix has cells around it, and these cells can become cancerous and develop into cervical cancer, which is something we want to catch earlier on because can be taken care of much earlier on. So, my name is Dr. Cheng Ron at the Texas Center for Lifestyle Medicine. Today, I'm going to talk about cervical cancer screening and how important it is. And so, when should we really be screening for cervical cancer? So, those women who have cervixes, which is most women, unless it's removed, or there's actually women that are born with a very small cervix or no cervix at all in very rare situations. But those women with cervixes should be screened at the age of 21, according to two major bodies, American College of OBGYN or ACOG, and as well as the USPSTF, the United States Preventative Task Force, which differs a little bit from the American Cancer Society. And so those people aged 21 to 29, according to ACOG or the American College of OBGYN, is recommended to get a pap smear every 3 years from ages 21 to 29. So a pap smear basically is a doctor or a allied health professional taking a sample of the cells around the actual cervix with a little tool. And so these cells are analyzed for cancerous cells. And so when that's done every 3 years between the age of 21 and 29, it allows for us to really look for cervical cancer. Now, what about ages 30 and up? So for those ages 30 to 65, there's an additional test that can be done. And that is called the HPV testing or the human papillomavirus testing. And so those starting at age 30, women can get a pap smear or a HPV testing or both. We call it a co-testing of pap smear and HPV testing. And so why this additional test? Well, what happens is during a pap smear is that the doctor can take a sample from the cervix, but there's a chance of missing some of the cells that may be cancerous, depending on the technique and depending on where the actual cancer cells are. And so, to overcome that, there we can analyze the viruses within those cells. So, cervical cancer, 99% of cervical cancer is actually caused or driven by one or many of the strains of the human papillomavirus. Some strains cause more cancerous and precancerous lesions than others. So, that way, we're getting a really good sample from both the actual cells that may or may not be cancerous, plus the HPV test, the human papillomavirus test. And so, the decision is to get this pap smear testing every 3 years, or get an HPV test or a co-test every 5 years. And so a lot of that can be determined between you and your gynecologist or your allied health professional or physician who's taking care of your pap smears. And it does require an individualized approach in some instances, and there's always exceptions. So we want to make sure that these are just general recommendations, but we do want to make sure that we have an individualized approach for the woman. Now, obviously, these guidelines are for cervical cancer, but one thing I do want to bring out is that a lot of women have had hysterectomies. So, a hysterectomy is the surgical removal of the uterus. However, in some cases, the cervix is actually left inside while the rest of the uterus is taken out. And so, but most cases, the doctor can take out the uterus as well as the cervix, because you don't necessarily need it, and it predisposes you to cervical cancer anyways if the cervix is left in. But in some cases, there's anatomical issues and surgical issues that the cervix has to be left in. And so if you have had a hysterectomy, or your mom or your friends or your family member, and they don't know whether a cervix is left in or not, it's really important to get an exam by the doctor, usually a obstetrician or gynecologist, to take a look to see whether the cervix is actually left in. If the cervix is left in, even with a hysterectomy, there still needs to be cervical cancer testing that's within the actual guidelines. So obviously, if you had a hysterectomy and the cervix is removed, we don't necessarily worry about it. So this is a overall summary of cervical cancer screening. Thank you very much.